Hello everyone, welcome back to my YouTube channel. So today I'll be discussing the first chapter from the Park's textbook of community medicine, that is the concept of health and disease. There are broadly four concepts of health: biomedical, ecological, psychosocial and holistic. And there are two definitions of health, WHO and the operational definition of health. And these are the various dimensions of health: physical, mental, social, spiritual, emotional, vocational, and other domains like socioeconomic, philosophical, etc. And what is positive health is another WHO definition we need to study, and the relative concept of health. Now, coming to the concept of well-being, they have to remember the standard of living, the level of living, what's the quality of life, and the various indices to measure the quality of life, like physical quality of life index and human development index, which uses three parameters: life expectancy at birth, mean years of schooling, and expected years of schooling, and finally the gross per capita income national level. And there are two or three steps given right after this on how to estimate the human development index. Next, we have the spectrum of health, like ranging from positive health, better health, freedom from sickness, to ill health, which consists of unrecognized sickness, mild sickness, severe sickness, and death. Now, what determines health? What are the determinants of health? There are biological determinants, behavioral and sociocultural determinants, environmental determinants, socioeconomic determinants, which can be subcategorized into four: economic status, occupation, education, and the political system, the aging of the population, the gender roles, the gender distribution, and other factors. There's an important diagram here that would be very helpful during exams when the question about determinants of health is asked. So I'm going to just draw it here for you. Please refer the textbook for the more accurate and legitimate diagram. Now, the next subheadings are ecology of health and the right to health, as defined by WHO and ICESCR, which has 4 steps. And next, we come to the responsibility for health at the various levels in society, that is, the individual level, community level, state level, and international level. There's also a small note on how the health and development in model of Kerala is a good role model for the rest of the country to learn from, and another small note on the concept of health development. Next, coming to the indicators of health, we have to learn how to differentiate an indicator from an index and the characteristics of an ideal indicator of health. It should be valid, reliable and objective, sensitive, specific, feasible, and relevant. And what are the various indicators? There can be indicators of mortality, morbidity, disability rates, nutritional status indicators, healthcare delivery utilization rates, social and mental health indicators, environmental indicators, socioeconomic indicators, health policy indicators, quality of life indicators, and others. The textbook then goes on to describe the various indicators of health in a little more detail. Firstly, starting with the mortality indicators, we have the crude death rate, life expectancy at birth, age specific death rates, infant mortality, child death, under 5 proportionate mortality, adult mortality, maternal or puerperal mortality, disease specific mortality, proportional mortality, case fatality rates, and years of potential life lost. Next, we have the morbidity indicators, incidence and prevalence. These are very important. Notification rates, OPD or health centers like attendance rates, etc. Admission, readmission, and discharge rates, duration of hospital stay, and sickness absenteeism. Next, we have disability rates, which can broadly be categorized into two categories: event type and person type. Under event type disability rates, we have number of days of restricted activity, bed disability days, work or school loss days. And under person type, we have limitation of mobility and limitation of activity. We also have few specific disability rates discussed more in detail. In my opinion, they broadly come under event type. We have health adjusted life expectancy, quality adjusted life years, disability or active disability free life expectancy or active life expectancy, and disability adjusted life years, or which is equal to the years of lost life plus years lost to disability. Now, nutritional status indicators can broadly be categorized into anthropometry, height at the time of entry, and prevalence of low birth weight. Healthcare delivery can be assessed by the following indicators: doctor population ratio, doctor nurse ratio, population bed ratio, population per health sub center, and population per trained birth attendant. Indicators to measure the utilization of healthcare services are, to name a few, bed turnover ratio, bed occupancy rate, and the average length of stay. Social and mental health can be measured by the following indicators: crime rates, suicide rates, smoking rates, incidents of drug abuse, to name a few again. And environmental health indicators are adequacy of sanitation facilities, water availability, etc. Socio-economic indicators are the rate of increase in population, per capita gross national product, level of unemployment, dependency ratio, literacy rates, especially for those of females, family size, housing, and per capita calorie availability. Next up, we have quality of life indicators, one of which we have discussed earlier, the physical quality of life index. And next, after that, we have social indicators, and we also have basic needs indicators, which is a list by the International Labour Organization, in, consisting of calorie consumption, access to water, life expectancy, doctors and nurses per population, number of rooms per person in a house, per capita gross national product, and deaths due to disease. We also have some special indicators. First up, by the World Health Organization, we have Health for All indicators, consisting of health policy, socio-economic indicators related to health, provision of health care, and health status. Next, we have the Millennium Developmental Goals, which is a set of goals established by UN in 2000. Out of that, goals numbers 1, 4, 5, 6, 7, and 8 are pretty important health related goals. 1 is eradicate extreme poverty and hunger. 4, reduce child mortality. 5, improve maternal health. 6, combat HIV or AIDS. 7, ensure environmental sustainability. And 8, global partnership for development of healthcare. Now we have sustainable developmental goals, which are listed by the United Nations and are set to be achieved by 2030. A decrease in global maternal mortality rate to less than 70 per 100,000 live births. Decrease in premature mortality by 1/3 of the current proportion from non-communicable diseases. Ending preventable deaths of newborns and under 5 kids. And decreasing the neonatal mortality rate to less than 12 per 1,000 live births. And decreasing the under 5 mortality rate to less than 25 per 1,000 population. Ending the epidemics of AIDS, TB, malaria, and other neglected tropical diseases. Halving the number of global deaths and injuries from road traffic accidents, and ensuring universal access to sexual and reproductive healthcare services. These are some of the few salient sustainable developmental goals. Next up, we have the global reference list of core health indicators. For health status, we have mortality by age and sex, mortality by cause, fertility, and morbidity. For risk factor indicators, we have nutrition, infection, environmental risk factors, non-communicable diseases, and injuries or harmful traditional practices. For service coverage, we have utilization of RMNCH plus A, that is reproductive, maternal, nutritional, child healthcare services plus adolescents. Immunization, HIV, prevalence of HIV with TB and TB individually, malaria, other neglected tropical diseases, screening and preventive care, mental health, and substance abuse. To assess the health system, we have quality and safety of care, access to healthcare, health workforce, health information, health financing, and governance. Next up, we have the Health Index of India, which is called by Niti Aayog, which broadly divides states into large, smaller, and states and united territories. And the health index is measured on 3 domains: health outcomes, governance and information, and key inputs and processes. Next topic is the contrast in health in between the developed and the developing regions. There are variations between the social and economic characters, demographic characteristics, contrasts in health, and the urban-rural health divide. Under health service philosophies, which is the next topic, we have healthcare characteristics. which are appropriateness, comprehensiveness, adequacy, availability, accessibility, affordability, and feasibility. We should also know the concepts, ideas, objects, and people involved in a healthcare system. In the broad levels of healthcare, that are primary, secondary, and tertiary. And what is the concept of a health team? And the WHO 2000 definition of health for all. And another definition for primary healthcare according to the 1978 Alma Ata Declaration. For health promotion, there are two conferences that you should remember: the Ottawa Charter for Health Promotion and the Jakarta Declaration on Health Promotion. It's in these conferences wherein key discussions regarding health promotion took place. It's also recommended that you see the health promotion logo because they can ask that in MCQ sometimes in competitive exams and stuff. Along with that, there are a few small notes on Millennium Sustainable Developmental Goals, health policy, and health services research, which can broadly be divided into three categories: that's biomedical research, intersectoral research, and health services research. Now, coming to the core concept of this chapter, the concept of disease. So for that, you should know the WHO definition of disease and then a statement by Susser which reveals how disease differs from illness and sickness. Now we have the concept of causation of disease, for which there are five concepts listed to explain the same. Firstly, we have the germ theory. Then we have the epidemiological triad, which consists of an environment, an agent, and a host. Then we also have an epidemiological triangle, in which time is at the center of a triangle. And then we have multifactorial causation. And lastly, we have the web of causation, which is a rather holistic explanation for how disease occurs. Next, we have the natural history of disease, which consists of the pre-pathogenesis phase, the pathogenesis phase, and the various agent factors like biological, which include in which we have to differentiate infectivity versus pathogenicity versus virulence. Then we have nutrient factors, physical factors, chemical factors, which can be endogenous or exogenous. Exogenous means in the diet, and endogenous is like hormones, etc., other substances in the body, and mechanical agents, and absence or insufficiency or excess of a factor necessary to health, and social factors. And we also have host factors, which are usually intrinsic, and environmental factors that are also extrinsic. We have physical, biological, and psychosocial factors. And we have risk groups that are based on biological, physical, and socio-cultural situations. And lastly, we have a short note on the spectrum of disease and the iceberg phenomenon. The iceberg phenomenon is very important. I have seen it being frequently asked. And the concepts of control, we have elimination, eradication, monitoring, and surveillance. We have modes of intervention. We have health promotion, which can consist of health education, environmental modification, nutritional intervention, lifestyle and behavioral changes. Then we have specific protection of high risk groups, of course, and early diagnosis and treatment. Disability limitation. So we have WHO definitions for impairment, disability, and handicap. Then we have rehabilitation, which can be medical, vocational, social, or psychological. There's also another short heading on the changing patterns of disease. And then we have population medicine, which deals with hygiene, public health, preventive medicine, community health, social medicine, and community medicine, which is basically what the subject is about. hospitals and community, and then the functions of a physician, and community diagnosis and treatment. Lastly, we have the disease classification, in which we learn about ICD, the International Classification of Diseases. Right now, we are following ICD 11 all over the world. And there's another short note on what's ICF, that's basically the International Classification of Functioning, Disability, and Health. There are a few small changes I would make with the subheadings. I'm making that now. So, this is a brief run through of the first chapter. Very important. It forms the basics for almost everything in community medicine. I hope this was helpful to help you digest what's there in parks. So, thank you and see you in the next one. One small thing that I forgot to mention, it's the third sustainable developmental goal that deals with health. I forgot to mention that.